Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. You know, when I looked at the paper this morning, I saw this picture of our beloved president serving his second term, mandated by the people to serve a second term, and in his second term wanting to do something to leave a legacy of his position as President of the United States, and that's health care. You know, when I think of it sometime, there's a right to health care, but you also have to write health care. R-I-G-H-T is a right. W-R-I-T is the right to health care. And if you can't write the health care, then you have no laws to protect your being a citizen of this great nation. So how do we do this when you have such a diversity of people all over the country meeting under one roof? By the way, that roof was built by slaves, the Capitol building and so forth, laid out by another slave, whole of Washington, D.C. The heritage of these great people who are not getting really good medical care. And not only they, but the immigrants who are coming into this country who built this to be a great country. Before the Great War, celebrating 150 years right now of the Civil War, in a sense, when Abraham Lincoln laid down laws to protect people. So today we're going to discuss the right of health, W-R-I-T-E and also the R-I-G-H-T. And so sit back and try to get this understanding, because you are a voice of this government and you vote. And you can make a difference if you vote. We have a Supreme Court now that is a Supreme Court that is changing year by year. And that Supreme Court oftentimes is chosen by the President of the United States, the candidates for that Supreme Court, which can make a difference in laws that are passed that can benefit all people, not just African Americans or immigrants, but everybody who's part of the United States. So I want to introduce you to someone that is at Downstate Medical Center, head of the diversity program here at Downstate, and his name is Kevin Antwine. Nice having you, Kevin.
Hi, Dr. Deas.
Yes. Kevin, we've been getting into this whole thing of the White House and its law. I just want to just read your first line here again. In 2010, I wrote the president when he came into office as such about health care. And he wrote a letter back from the White House. From the White House. He took a little time. You say, well, he's just doing that for publicity. No, that wasn't publicity, because he gets thousands of letters. And so for him to pick out one letter, or for the group to pick out a letter, it's meaningful. I mean, because it's not just me. He said, "Dear Dr. Deas, thank you for writing. After a century of striving, after a year of debate, and after a historic vote, healthcare reform is no longer an unmet promise to the American people. It is the law of the land." Can't say anything more than that. We're going to talk about the law of the land and why this law has to remain and develop and give everything from that tiny little person up in Appalachia to the one in Harlem a chance for having health, anything from nutrition to prevention, things like this. So I want to welcome you.
Thank you, Dr. Deas.
Nice having you with us. Kevin, I know maybe someone hasn't really, maybe saw the first program, but just if you could just briefly, your background of how you're here as the officer of the diversity program here.
Sure. Well, I'm the Chief Diversity Officer here at Downstate, also an assistant professor of health law and health policy in the College of Nursing. I've been here about 6 years. In my education, I received my law degree from William & Mary. I was a former fellow at the Harvard School of Public Health, and have a executive certificate from Cornell in change leadership. And so I'm a veteran of the Air Force, and I'm from the great sovereign state of Mississippi.
All right, filmed from Mississippi.
From Mississippi.
Oh man, you know, that was the first thing we used to learn how to spell. Mississippi. When you could spell that out, you thought you were on the right track. You know?
That's a lot of letters.
A lot of letters, man, and you couldn't skip any letters out of Mississippi. You know? But coming out of Mississippi, of course, you have a family. Just briefly, your family background.
Sure. My father was a retired Air Force Master Sergeant. He spent 25 years, served through World War II, Korea, and Vietnam. And my mother was a 6th grade elementary science teacher.
Right, right.
7 kids, 4 boys, 3 girls. Were sort of scattered all out. I have a brother that's a retired Navy commander and assistant school board superintendent in Virginia Beach. A brother that's a retired Army Master Sergeant. Another brother that is a retired Army Colonel and a physician and currently is the Chief of Staff at the VA hospital in North Carolina. 2 sisters that are in education down in Mississippi. And my oldest sister is an assistant professor at the University of Mississippi Medical School in Jackson, Mississippi.
Right, and one thing we don't want to leave out is your daughters and your one son.
That's correct. My wife Natalie and I, we have 4 girls, all older girls, and our 11-year-old son, Michael, who is in the 6th grade.
Right, yes. Well, he must look at you like you're a giant too. You know, I met him several times coming to school with you, bringing them to school, and of course, you know, children look at their parents like, "Hey, what's so famous about you?"
Right.
But unless they hear you, or they sit in an audience that's listening to you, then they get the picture.
Right, they do. Well, you know, I spend, you know, a lot of time with him. I coach a couple of his little league teams, but occasionally I bring him to places where, you know, I speak at, so then he can see me outside the role of dad and outside the role of coach. There was one story where a kid brought in I think a letter to the editor that her mom or dad had written to the local paper in Old Bridge where we live. And so I guess he figured he would top that. He brought one of the magazines that I was in on the cover and he gave it to the teacher. So he keeps us laughing.
Well, you know, I have a cousin in the Air Force right now too. He's a Brigadier General, James Whitehead. James Whitehead, was one of the first flying reconnaissance planes and things like that, and he's still active with the African Americans, pilots and things like that. You know, so we come back from, and we come out of Virginia and South Carolina, you know, and so forth. So basically, there's a whole lot of history connected to that.
That's correct.
You know, but getting to health issues and getting to your position here, while you're being part of the faculty here, because we didn't have this a few years ago. What was the purpose of bringing you here and becoming a Department of Diversity?
Sure. Well, I think that there were a couple of things. Number one, it was sort of mandated by the S.U.N.Y Board of Trustees by a policy that they enacted that required that campuses within the State University of New York systems have a Chief Diversity Officer. So it set it up in the framework of, you know, who the position reports to, how you fund it. You know, I report to the president, how you convert budget lines to fund the office. So it was mandated. And then the Joint Commission, which accredits hospitals, also requires that you have a executive over what's called this new cultural competency standard, where you have to look at the culture of the patients now and helping to determine their clinical care. So it wasn't voluntary, but sometimes you have to force the hand to get things done. So my position came about because it was mandated both by federal law and state law.
Right. Now, when you arrived here, we talk about diversity and things like this. Did you get many calls from the people who work, say, in this university about their position here in the university?
Oh, sure. Well, you have to imagine when I arrived here, I'm the first person to actually serve full time in this capacity.
Right, sure.
So there was an instant flood of calls and things as to they needed some clarity or things that could be
Right.
helped with, and the office and I worked our way through to make sure that we answered every question, saw every person that had a question about it. And I think that sort of, for lack of a better word, endeared us or established at least that we were fair about the process
Yes.
that we were undertaking. Not that everyone would agree with
Right.
a decision that we'd come out with, but I think what the population here I think discovered was that we were willing to listen, that we had an open door, and we were going to treat everybody fair about it. You may not
Yes.
agree with the outcome, but you certainly couldn't disagree about how thorough we were in looking into it to come to the outcome that we came to.
Yeah, that's so important because there's so many rumors that go in any kind of institution. And rumors are the worst thing. They're so destructive and so forth. But to have a rumor that that finally they're being listened to can go as much positive as something
correct.
negative.
That's correct.
And so I know that you have worked hand over fist with very small staff to do that, and that takes a lot of endurance and listening to people's really complaints about what's going on in their lives and making a living.
Well, that's true. I mean, we is currently a staff of 3 for a workforce population, without even including the students, that hovers around 7,000. And then the students is an additional 2,000.
Yeah.
So we're pretty busy, but when you're an expert at something, you know how to manage your time and be productive
Surely.
in what you're doing, and so and that's sort of what we do. We do have some standing committees that are a great aid to us. We recently established the Cultural Competence Committee here at the hospital to address some of the hospital issues with respect to patient care. So when you come into a position like this and you have the background and the expertise, you are expected and you should carve out an area that there are positions and standing committees that can help you fulfill your duties and responsibilities.
Yeah, because I look at with our patients laying in bed, they feel quite alone, and to know that nurses and doctors are being looked at from the standpoint of how they're even treating a patient, you bring a whole new aura of competency among staff if they know that someone looking over their shoulders.
Oh, true. Well, one of the things that we're doing in conjunction with the Office of Patient Relations is that we're doing mandatory training for all hospital employees that see patients on 2 aspects. There's the customer service aspect, just basically being nice and polite to the patients when they come in, and then the Joint Commission Cultural Competency Standard, where we're not trying to make our healthcare practitioners experts in every sort of nuance that there is in a patient's culture.
Right.
But with respect to our own patient population, there's some things that you need to know about our own population so that we can enhance their treatment.
Sure.
So you need to know a little bit about their religion. We encourage them to try to say a few phrases in the patient's native preferred language, if it's not English.
Right.
And we want you to address the patient, Mr. and Mrs., unless the patient says something different.
Right.
And there are times where we have to use interpreters, but we want you to still maintain eye contact with the patient. But beyond all of that, it's really just to be having common sense, being polite to the patient.
Oh, yes.
Because under the new health care law, patient satisfaction now is a portion of the reimbursement that the hospital gets back from the government if you have Medicaid and Medicare patients like we do.
Oh, yes.
So now, once the patient is discharged and they get that survey that we send out asking how was their care,
Oh, yeah.
initially, when the Healthcare Affordability Act was rolled out earlier this year, as much as 30% of our reimbursement rate could be tied to the patient's satisfaction about how they were treated.
Yes.
Now that will be going up in 2016, somewhere between 40 and 50%.
Whoa.
So now you're not only encouraged just from a politeness and respect standpoint, but now it affects the bottom line. It affects our profitability. Even though we're a public hospital, we don't make profit. We still want as much as our reimbursement that we're entitled to, and now that's being tied to how patients fill out their satisfaction form when they're discharged as to whether or not they thought that the service that were provided to them was, fair, good, average, or, really good care. So now in the whole landscape of healthcare under the new Healthcare Affordability Act is really centered to how patients perceive they're being taken care of.
I walked through an emergency room just yesterday, and there was an elderly African-American lady sitting in a wheelchair, and she was kind of bent over, and there was a caretaker next to her. And as I came through, she said, I went over to touch her to say, "Hi, how you doing?" And she said, "I could use some water." And so she said she had some bread even stuck in her throat. And so I went out and I walked around to the cafeteria, and I got her and the attendant a cup of water with ice in it. And when she got it, she said that, I sensed that you were going to do something for me. That's why I asked you, at that time. And she said, that ice was so good. She said, because the ice out of the machine is very fragile, so it can crack between your teeth and give you kind of a refreshment,
Right.
And she was so thankful for a cup of water. Now, I didn't know this lady. I wasn't trying to be overzealous about, but I'm just saying you saw somebody sitting there. So that's what a hospital is all about. Once you enter those doors, from the guards to the clerks to everything, is dependent upon whether they ever want to see you again or come back for the care.
True, right, but I bet you that cup of water you gave her probably influenced how she's going to fill out her patient satisfaction form.
That's what I'm saying.
It's those little nuances that determine whether or not the patient feels like the care that they've been given here was satisfactory to them, and little things like that make a difference.
It does. It certainly does. Now, with your position here, is there any time you have to go to court for anything or in defending anything that you do?
Well, we actually have to go to court and litigate. The General Counsel's office up in Albany or in the Attorney General office, because we're a part of the state, and the Attorney General represents downstate when we actually have to go into court. But when there's what we would call administrative hearings before the Equal Opportunity Employment Commission of the federal government or the New York State's Human Rights Commission, our office, in conjunction with the General Counsel's office up in Albany, and sometime our own labor relations office here, we go as a team to mediate or arbitrate those cases.
Well, just talking to you in a little short span of time, thinking of what you're doing in a big span of time, it's impossible for you to be not worn out. When I say that, is there any assistance that you can bring along to help you do some of this fantastic work to make any place?
Oh, sure. I hired another lawyer in the office about a year ago, Shondell Goldsmith. She oversees what we call the Title IX enforcement, basically to make sure that regardless of a person's gender, that they're not being discriminated against, not being treated unfairly because they're a woman. She also oversees our EEO enforcement. She does a lot of the initial investigations with respect to race, gender, and disability. So she's been a great asset in the office, and a New Yorker. So she's from Brooklyn.
Well, taking this again from a face, a frown to a smile, do you think this face is going to smile when all is said and done, and we look after diversity and all the other things that immigrants coming into the country need? Health care. I can see Barack maybe getting to the end of these 4 years and smiling and saying, we did it. You know, and that's a great achievement when somebody, because he's still a young man.
Yeah, he's still a young man. Well, if the president never does anything else, I think there are two things initially he's always going to be remembered for, and no matter what happens in present day, he's going to ever be able to change that. When the world economy was on the brink of collapse,
Yeah.
he saved it.
Right.
He saved it.
Really? Sure.
He got the stimulus package approved, got it out to the states,
That's right.
got the world markets, got the Chinese not at default on our credit, got the world stable, got
Right.
the European market stable, the Asian market stable.
Right.
That's never, the world's going to always be indebted to him for that, because we could be in a depression far worse than the depression of the 30s if
Right.
it wasn't for his, on hands oversight, management, strong army, the economy to get it up and going again.
Right.
The world will forever be indebted for him to do that. The other thing is healthcare reform. Now, there's some of the healthcare that a lot of people disagree with. There's some nuances that, I don't agree with portions of the mandate where you have to go out and purchase it. But at least he got healthcare on the table in the form of federal law that now requires uninsured people to have some sort of health protection, where they can go into the healthcare market. There's a couple of ways you can do it. If your state participates, your state can have its own healthcare market, which here in New York we have our own exchange. So unlike the website problems that are happening with the federal government, New Yorkers don't have to go through that. They can go into the New York website, and they can shop for insurances that fit their need. There are a variety of packages, from the gold, the platinum, the silver, the bronze. Bronze being the least, the platinum being the most expensive. Somewhere in the middle is the silver. You could, it's sort of like if you go online to, buy a car or something. If you get the basics, that's the bronze. But, say you want the CD player and the GPS, that costs you more money, and so your premiums go up as the more things that you include onto it. So what I think that you're probably going to see at some point, the United States is going to have to treat healthcare like the other industrialized countries of the world treat it, where it's an actual right that you don't purchase, it's just provided. It's like the right to vote, like the right to free speech. But this is a stepping stone, because Roosevelt tried to do this, and he was perhaps, among the greatest presidents we ever had, served 4 terms.
Right.
He couldn't get it done. The Kennedy administration, which had drafted a lot of the legislation that President Johnson takes credit for, the Civil Rights Act, Medicare, Medicaid, all that was written during the Kennedy administration, but it got passed during the Johnson administration. But we couldn't get health care. Hillary Clinton, under her president Bill Clinton, tried this, and it didn't get passed. So it was left up to one of the youngest presidents ever elected, the first African American or of African descent president ever elected, to actually get some form of federal health care under federal law that now allows uninsured people to have insurance. And I think what we're going to be moving to is that there were, if you can remember, when he was running for office and he talked about the public option, just sort of a Medicare for all. We're probably going to be moving to that. There are a lot of people that say that that's, socialization of medicine. But historically, these are things that we agreed to, years ago. On one of the other shows that we did some time back, I talked about how after World War II, when the United States and the Allies came together and created and formed the United Nations, the World Health Organization, and all their constitutions and their articles talked about a right to health care. And in order to ratify, to be a member of the United Nations, World Health Organizations, they all had to agree that you would have a right to health care in your own country. Well, all the signatories did that except for the United States, and we were the main craftsmen of the legislation, of the treaties, of the United Nations, of the World Health Organization, the Universal Declaration of Human Rights. So I think we're 60 years late, but I think we're back on track tracking it at. So if President Obama, never passes anything else, if he never champions anything else, the world will always be indebted to him because he saved it from the brink of collapse.
Right.
That had happened under another administration. That we were involved in 2 wars. There were people were being given mortgages that they couldn't afford, and the United States was teetering on self-destruction.
Yes.
President Obama came in and saved that. So whatever happens from here and his last 16 months in office, he will always be given credit from a historical. His legacy is already set. There's nothing he can do
That's right.
to change that.
That's right.
Nothing at all.
That's right.
If he never passes another bill, if that website never comes up and works, that will be a footnote in history compared to saving the world economy. So when you see these sort of pictures that you see in the New York Times today, you got to know that there are some people that no matter what he does, they're just not gonna be in his corner.
Right. Well, since time is our enemy, just maybe 10 seconds on, do you think we're fighting the Civil War all over again?
Well, there's a lot of similarity between he and Lincoln and the things that they're going through in Congress. I think it's not so much the Civil War, is that it's the president's race. There's just a group of people in the country, elected officials in Congress, that have not gotten over the race of the president. And I think that's the 800-pound elephant in the room. I think that's the crux of the lack of communication between certain members of the Congress and the president. Because I'm 54 years old. I've never heard a president, or I've never heard electing standing members of Congress talk so disrespectful about a standing president, about a president in office. So, but again, no matter what they say or do, his legacy is written.
Well, I tell you, on that note, his legacy is written. I thank you for coming with us
Thank you, Dr. Deas.
And to you folks, the legacy is ours. People died, wars and civil wars and things like this. Why shouldn't we be so concerned about the needs of our people, whether they born here as slaves, or whether they are immigrants and are here now in a legal form, working and paying taxes and all these kind of things. And to all you representatives in Washington, senators and congressmen and so forth, to not have this as part of your whole agenda, to say health care is good care, health care is a needed care, and health care can serve everybody's care. So this is Dr. Deas, and hopefully you will care and make a change.